In general, or on a broader terminologies, we classify our arthritis into first is osteoarthritis, second is inflammatory arthritis, and third is traumatic arthritis. So we'll discuss one by one in short and brief in a layman words.
Yeah.
So first is osteoarthritis. So any term when a patient comes to us and say I have an arthritis, they most of the time they mean it is called osteoarthritis. So what is osteoarthritis? Osteo is bone, arthritis is any inflammation and pain inside the joint. So osteoarthritis means it is a wear and tear phenomena. It's a wear and tear arthritis. It commonly happens in a old age, more than 50 years of age. It is a wear and tear due to old age, or we can call it as degenerative arthritis. Degeneration means it's a wear and tear. What is degeneration? So when a normal child, from a child age to a old age, there is a minimal amount of damage while we walk, while we sit, while we run inside the knee. So once these damaged cells are being repaired immediately over a period of time. So when there is a difference or when there is a lag in this repair, so when there is a damage, there is a repair. So when there is a lag, so the damage is more than the repair. So this difference happens, the gap increases over a period of age. So that leads to more destruction than the repair. So that leads to what we call as a degenerative or arthritis, or also called as osteoarthritis. So any patient over 50 years of age, or 60, 65, 70, or 80, or 90, when they come with a damaged knee or pain or stiffness, any symptoms in the knee, the most common diagnosis we think is a degenerative wear and tear phenomena. So that is called as an osteoarthritis. So the second classification, what we call as an inflammatory arthritis. What is inflammatory arthritis? There is some kind of inflammation that is happening. We call it a systemic inflammation. Systemic inflammation is that is being involved in the blood, in the tissues. It can happen anywhere inside the body. So that is called as, there is some inflammatory phenomena going on. So that is soreness which is happening inside the bodies. So the most common cause of this inflammatory phenomena is the rheumatoid arthritis. The second, what we call the common, is psoriatic arthritis. So these two types are called as inflammatory arthritis. So what is rheumatoid arthritis? Rheumatoid arthritis commonly happen in a middle-aged females, okay, and less common in male. So what is rheumatoid? It is an autoimmune condition. So what is an autoimmune condition? So these are some antibodies. Antibodies means these are protective mechanisms that are being developed inside a body. When we have a cold, when we have a fever, there is an antibody which are being created to fight against this fever, cold, or any bacteria or any virus. These are so. Or when we call it as an autoimmune, so the antibodies which are formed inside a body, these antibodies are formed against our normal cells. Normal cells means those cells in and around the joint, or it can be in the eyes, it can be in the heart. So when an antibodies are formed against our normal cells, these are called as an autoimmune. So they cause more destructions inside the body, so inside the tissues. When these rheumatoid arthritis is systemic, when what is called systemic, or it can be also called local. Local means only one particular organ is involved. Suppose knee means knee is involved. Hip means hip is involved. So when we call systemic, it can involve eyes, it can involve spine, it can involve liver, lungs, or kidney, or anything it can be involved. So it's called systemic. So rheumatoid arthritis is a systemic conditions, out of which one part is the bony involvement, of which the joints are more commonly involved. So rheumatoid, how it happens? So it can be spontaneous. Suddenly one day that those antibodies are formed against our normal body cell. That is called as spontaneous, without any reasons. There is no specific reason for it. The other type is hereditary. It can run through families. So when we say rheumatoid arthritis, it commonly affects females. It can affect any joint. It can involve small joints, the finger joints. It can involve the foot joints. It can involve knee, hip, elbow, shoulder. So generalized stiffness. Normally they present with early morning stiffness, stiffness on your fingers, stiffness on your knees, and slowly it progresses to an extensive stage. So the second type of inflammatory arthritis, what we call the psoriatic arthritis. So what is psoriasis? You might have heard about the skin lesions called psoriasis, scaling of skins. There are lesions all over the bodies. So this is also a kind of an autoimmune condition which predominantly affects skins, but secondarily, it creates a systemic illness that also involves the joints, involving knees, hip, and small fingers of the joints. So when we say inflammatory arthritis in India, the most common cause is rheumatoid arthritis. The second is the inflammatory arthritis. There are n number of reasons, but commonly we discuss. And the third type of arthritis, as we said, the broader classification, third type is a traumatic arthritis. What is traumatic? Any injury during your life in the middle age, which happens in and around your knee or in and around any joint, that has deformed your alignment, that has changed your alignment. Normally, you have a straight alignment from hip, knee, and an ankle. Suppose if this alignment has been changed following a fracture above or below the knee, can lead to early damage of your knee joint, that we call it as a traumatic arthritis. Normally, a knee gets damaged after 60 years of age. Suppose any change in this alignment can lead to early wear and tear, means you can have it over age of 45 or 50 years, is 10 years, a decade before the knee gets early worn out. So these are the three in broader perspective, we can classify the types of arthritis. As a patient, we wanted to know what type of arthritis do we have and how we are going to manage it.
That was very elaborative, Dr. Bharat. Dr. Bharat, how many people are suffering by arthritis in our country?
That's quite interesting. And as in this discussions, we would stick on more to an osteoarthritis. Osteoarthritis is due to age. So that is going to be the more commonly used. So in general, we say the females are more commonly affected for n number of reasons. Due to the poor bone qualities, osteoporosis, hormonal changes, short stature, obesities. These are the n number of factors that leads to a more common osteoarthritis knee in a female. So out of 100, 50% of the females are more affected at present in India. And when it comes to our male populations, it is almost 30 to 35%. That is, out of 3, 1 is involved, whereas in a female, out of 2, 1 is involved. Whereas when we say arthritis on a global picture, this osteoarthritis knee due to wear and tear, that is degenerative process. India is one of the leading nation where the knee is involved. Whereas when we consider hip, suppose you consider in the United States, the hip is more commonly involved. The reason is not well known because of the genetic predispositions and so on. So when we say when it is the prevalence, out of 2, 1 female is involved. Out of 3, 1 male is involved.
That's alarming, doctor. Doctor, is arthritis occurring only in old age?
That's, I think I've clearly explained. Arthritis do involve from extreme age groups. Or when we say inflammatory arthritis, as I said, rheumatoid arthritis, or in rheumatoid arthritis itself, we have 2 groups. One is an adolescent or maybe called adult, or one is called juvenile. Juvenile means in teenage group. So we have seen arthritis quite early, from 10 to 13 years of age, and we can see arthritis up to 95 years of age. So there is no specific criteria that arthritis happens in old age only, because the arthritis itself is a general terminology. We cannot, as a patient, one have to know what type of arthritis do I have if they have an arthritis. So when I say inflammatory arthritis, it should be in a middle age or in a younger age group. When we say osteoarthritis, mostly we are saying it is as old age arthritis or degenerative arthritis.
Okay, doctor. Doctor, what is affected in knee arthritis?
So as I said, it's a wear and tear phenomena. I just love to explain with this knee. This is an artificial knee. You could see this is how a knee works, and this is what we call as a femur bone or the thigh bone, and this is what is the leg bone, and this is what is that articulation that happens inside the knee. Okay, there are 2 major parts. One, this blue part, you can see, we can say it as a cartilage. That is a smoothness. That's a smooth area that articulates with one bone to the other bone. And these are certain ligaments and meniscus, which has like a cushion or shock absorbers and stabilities. So when there is a wear and tear which happens, or what happens is first there is simultaneously there is a damage of these meniscus, these ligaments go for an attrition, and slowly this surface, this smooth surface gets eroded or eaten up. It is the patchy, and over a period of time it can involve in the percentage, 10% involvement, 20% involvement. When we say knee, there are three compartments which we speak. So what are the three compartments? When we say this is the inside, this is the inside part, the opposite side is the outside part of the knee, and this is the front part. So we call it as medial, lateral, and the anterior compartment. We say it in compartment. So the most common compartment which we say is the inside compartment, the medial compartment. So that when that is damaged, so initially there will be erosion or a defect of this particular surface. When the cartilage gets eroded, when the undersurface of the bone get exposed, there is the onset of pain. So when this part is eroded, so there slowly the knee progress into a deformity. So that deformity, what we call it as a bend, bowed legs. So that's why you see old age patients having a bowed legs. So the major part involved in arthritis is this smooth area, which we call as cartilage. The cartilage gets slowly worn out in terms of slowly 5%, 10%, and slowly from one compartment to the other compartment, and it completely gets involved. So that is called as arthritis, and that's how we stage these arthritis. We can say stage 1, stage 3, stage 4, or we can say as mild, moderate, and severe.
That was very easy to understand, doctor. Thank you so much. My next question to you is, what are the treatment options for arthritis?
Yeah, that's quite interesting to say. So as I say, arthritis, any disease, as we say, any disease in the body we start with what we call as a conservative option. The conservative treatment is, and we slowly go to a non-surgical options and surgical options. So any disease in the body, any problem in the body, we have multiple options for treatment. So same as for an osteoarthritis knee. Okay, the treatment is it depends upon the stage of the disease and the symptoms and the complaints of the patient. Okay, that's how we are going to plan our treatment. So what is in the initial stage, what we call as a mild stage, then we can say go to moderate and severe stages. So when we say mild stage, so these patients are going to present us. So how do they are going to present us? They're going to present with pain, some kind of redness, some swelling, some stiffness. So these are the common complaints. Apart from them, when we take an X-ray of these patients, we found the joint space are quite well maintained, but still the patients have the problem. So these patients are going to manage with, one is medical management. The first is medical management. So what are the medical managements? We are going to give an anti-inflammatories, because inflammation, the soreness, is a key cause for the pain. So we are going to treat it with our anti-inflammatory drugs that indirectly we can call it as painkillers. Some are and the other supportive medications. So the other supportive treatment is we are going to give them a good cold compress. So when there is an acute pain, severe pain for 3 to 4 days, we are going to give a lot of cold compress. And next, what we roll is the physiotherapies. There are a lot of tools in physiotherapies that can reduce your pain. So the physiotherapy tools means like interventional physiotherapy, like interferential therapies. You can use shortwave diathermies. These things helps us to reduce the pain acutely. But the core is the rehab. The rehab means the exercise. We are going to strengthen your muscles in and around the joint. So that is going to indirectly reduce your pain by offloading the weight on your knees. So when there is a mild to moderate disease, the key tool to treat these patients are medical management, physiotherapy. These are the two major modalities. And the third important thing as a doctor, what I advise to these patients is, apart from these two, medical management, physiotherapy, and the third is what they have to follow is the lifestyle modifications. So what is lifestyle modifications? Is the first and foremost is the weight reduction. So when I assess a patients, when they are overweight, I advise them to reduce weight. So it is very easy for these patients with a milder disease. So they have an opportunity, they can still try to reduce the weight by diet, exercises, and Other important lifestyle habit modifications. Once they develop, old age patients, once they develop a mild to moderate disease, what I always advise them is to avoid strenuous activities to the knee. So what are these activities? I ask them to avoid sitting on the ground floor, sitting cross-legged on the floor, avoid climbing stairs as often, avoid standing for a long time, and avoid using Indian closets, Indian toilets. So what happens when you use these kind of postures? So they are going to strain your knee more. Suppose when I treat a patient with a milder disease, so after 5 days, these patients are going to have a good recovery. So once they return back to the normal activities like sitting down on the floor, using Indian toilet, and of course the pain is going to again come back, and they're going to have a constant pain, which is going to become acute on chronic, and later it's going to become a chronic pain. So lifestyle modifications going to play a key role, out of which in lifestyle modification, weight reductions is one of the key role to reduce the pain. So when we say a moderate disease, when patients have been given a lot of options of like medicine, medical management, physiotherapies, and still they are not relieved of pain. So there are a lot of options like arthroscopic lavage. We just go a keyhole surgery. We go for a complete debridement, what we call it as, we just clean up all the dirts available inside the knee. So that can also reduce your pain. And when in a severe stage disease, when there is complete damage of your cartilage and a deformed leg, when the legs are bowed, then the final option would be a surgical management that we call this as a total knee replacement.
Thank you so much, Doctor. Dr. Bharat, what is your opinion on knee injections?
Yeah, that's one of the most popular treatment which is right now available, but I don't stand by that side. The reason is, this knee injections can be used in between mild to severe stage of the disease, but internationally it has been not documented that, or none of the reports have showed that these injections are showing any benefits in the treatment of knee osteoarthritis. The common type of injections which are used are steroids and the gel shots, the hyaluronic acid, the gel shots. So, of course, you know what is going to be the action of the steroids. They are going to reduce inflammations, and the patient is going to have an immediate pain relief. Maybe the patient can have a pain relief within a week, and that pain relief can extend for a month or two. Some patients do have a recovery up to 1 year, but these injections are not a permanent treatment for knee osteoarthritis. And of course, gel shots. These are gel shots. So when these are injected, they claim that they increase the lubrications, thereby reduce the inflammation, thereby promotes healing of these cartilage damage. But everything has been proved outside. But when it is injected, the results are not clearly stated, and the chances are almost up to 50 to 60% only. So one major side effects of putting a knee injection. Suppose if when you put a knee injections, and if there is any chances that you likely you seed some bacteria inside your knee, so that is going to infect your knee, and that is going to be your end of the end of that particular complications. Then you have no options left for any further treatment, because once a knee gets infected, it's going to be messed up. It's going to be messed up, and it's going to be a trouble and for the patient. So in my experience, I have hardly used knee injections, maybe hardly till now in my whole practice. I have used hardly to 5 to 10 patients or the knee injections, and these I have to select these patients. Who are these patients who are going to really benefit for it? So on a randomly on using knee injections for all sorts of patients, I would say it's a contraindication. I don't advise, and I also would love to stress this point in this particular point of time to all these patients. Kindly avoid knee injections as much as possible, once until otherwise it is highly recommended by an expertise.
What if advised? Is it costly?
Yeah, as I said, it's costly or cheap. It doesn't matter whether it's going to benefit or not. It's going to be is a thing. When we say it's cost, I mean, steroid injections hardly is going to cost $200, and the injection, everything you can wind it up around by $1,000. When it's gel shots, the cost is going to be a little high, maybe around 12K, 12,000 bucks. And all the procedure charges and everything would land up around 14 to 15,000 rupees. And that's what these injection costs were. But apart from the cost, I think these costs are nothing for at present economics and economy. But still, whether it has to be used or not, from my side, I would say no. So no injections.
Okay, Doctor.
For an osteoarthritis knee.
Dr. Bharat, wanted to ask you this question. Actually, this question is quite big. I'll go one by one. Is knee replacement really needed?
Yeah, there is a point in the stage of the disease. So what I always say to patients, or what do I practice, is what is more important. So any patients who have given a considerable conservative trial, means they have tried all non-operative measures. They have tried all non-operative measures like medications, physiotherapy. So they have tried to an extent that they have reached to a point that none of the other treatments are going to help them. So this is one criteria which I always have. So whenever I see a patient, I don't jump and advise them on knee replacements. I would love to explain them what is the knee arthritis, and what is the reason for this arthritis, and how long this knee arthritis is going to, and what is. Most of the time, the knee arthritis, the symptoms are going to be fluctuating. So 3 months, they're going to have a severe pain. The 3 months, they're going to be better again and again. So when this frequency, 3 months frequency is going to shorten, then every month the pain is there. So then they are almost approaching to the knee, towards the surgical procedure. So what are my 3 indications? The 3 main indications for a knee replacement is: 1, the patient should have a pain that is considerably affecting his or her daily activity living. When a patient comes to and say to me that I'm not able to do my daily activity, I'm not able to go to the kitchen, I'm not able to go to the toilet, I'm not able to go up to 100 meters, then that is a considerably disability. So that is one. So when this disability makes them to seek repeated doctor shopping, means they go to doctor by doctor and doctor, they get good amount of prescriptions and they keep on taking painkillers. So old age patients, most of these old age patients are going to have an associated comorbidities. What is comorbidities? Like diabetes, hypertension, thyroid issues, and n number of problems. So when these patients take on regular painkillers, they are going to have an ill effects on your kidney. So all of a sudden suddenly one patient land up with emergencies with their kidney problems, and indirectly we have encountered that they are taking painkillers for the knee problem. So these are the patients which we say. So one criteria is patient presenting with a problem that is affecting his or her daily activity living. Second, when these patients are on regular intake of painkillers. So when they're taking out of for 7 days in a week, they're taking 4 days painkillers, then that is not a good. So these are the patients which really requires a knee replacement. So the X-ray damage or the symptoms doesn't matter for me. But when these indications, when this alarm starts buzzing, then I would advise you require a knee replacement.
Well, doctor, what about the last stage? Will it be severe?
So age is definitely not a criteria for knee replacements. I have done the young. I don't get you.
What is the last stage? Will it be severe?
The age.
And will regular painkillers help?
The last stage. There is nothing we call last stage. So we have seen patients with severe stage comfortably walking, able to do their daily activity living. So they are quite comfortable managing it. So that's why I always say to them, if you are comfortable and if you are able to do your daily activity living, you can just drag it for any number of days. When a point has come when their daily activity living is affected, then you are a case for a knee replacement.
Dr. Bharat, you have pioneered in smart knee replacement technique. Can you educate us on this?
Yeah. What is smart knee replacements? It's a technique of doing a knee replacement. Okay, it is a knee replacement. We call this total knee replacement. So it is a technique of doing knee replacement. By this technique, we are able to precisely execute the procedures that lead to n number of benefits to the patient. So we cut the tissue less, we handle the tissue less, so the blood loss is going to be indirectly less. Normally, it takes at least 2 to 3 hours to do a knee replacement. With the help of this technique, I'm able to execute this knee replacements in 20 to 25 minutes. So what are the advantage of doing it so early? So we are going to handle the tissue less, the blood loss is less. So what happens? The patient pain factor post-surgery is going to be very minimal. So I am able to mobilize, means patient is able to walk after smart knee replacement within 4 to 5 hours after surgeries. So within the next day, patient is ready to climb stairs, and also patient is able to get discharged within 24 hours to 48 hours after surgeries. So it is a fast track procedure. It's a fast track procedure. The intention is not to send the patient home faster. The intention is to give them a faster recovery. So giving a faster recovery, patients, even the physiotherapy post surgery is going to be very easy. The rehab protocols, the recovery durations. So when I do a single knee replacement by smart technique, the patients are able to go to the routine life within 15 days of surgeries. So once the stitches are removed, 15 days, they can resume their normal activities of living. So these are the key benefits. So it's a technique of doing knee replacement. It helps in fast track recovery. The complications are quite reduced. The patient's rehabilitation becomes easier. The recovery is faster.
That's great, Doctor. Dr. Bharat, most common question from patients is how many years does the replacement last?
Yeah. I would always say a well-done knee replacement. A well-done knee replacement means it has to be done properly, executed properly with a good implant. It should last for 20 to 25 years without any problem. That we call it as a survivorship. But there are a number of factors that can affect the survivorship. If any infection happens, it can loosen out early. So in a medical field, there is nothing called 100%. No doctors can give a guarantee. It's not like any electronic goods that you get a guarantee. But a well-done knee replacement in a patient can last for 20 to 25 years without any problem.
Is there any age limit for knee replacements?
Yeah, there is definitely not an age, no age limit. My youngest age group, I've operated on a 17-year-old girl. And my elder, the highest age group is 92 years of age. Okay. So what 92 years, what they're doing. So such patients are quite active. We have seen 92 years age patients quite active. And they want their knees to be get well, and they wanted to do whatever years, their remaining years they are going to live. So age is not a criteria. It is a fitness. At the older age, it's a fitness. Once they are physically fit, once the body condition is fit for surgery, you can execute a knee replacement even in that age group. I'm saying the extreme age group, what I have operated is 92. On the other age, there are some school of thought you are young and you don't require knee replacement because it's going to last only for 20, 25 years. If you get operated at 40 years of age, at 60 years, what is going to happen? When you're operating at 17 years of age, what is going to happen? So it all depends. When we say rheumatoid arthritis is going to affect your knee joints. It is going to completely erode your knee. Completely, it's going to erode your knees. There's nothing is going to left in your knees. The patient is completely disabled. Suppose I operated a month before a teacher. She's just 39. Her knees are complete. She's not able to stand. She's not able to walk. She's not able to go to school because of rheumatoid arthritis. So what I have to do is her daily activities living affected. What she wants is immediate quality of life. It is not how much years she's going to live. It she want to go the next day she wants to live. So that's where we have to give this knee replacement to these kind of options, these kind of patients. So age is not a criteria. If it is damaged, if it is completely damaged, and if you are disabled, knee replacement is the only option. Okay, if none of the option is opted or available, knee replacement, irrespective of the age, you can go through it. So what happens after 20 years of age, or what happens after 25 years of age? There is something called as a redo procedures. So we do a revision surgery. What happens? Normally they last. There is always a plastic which comes in between the processes. So when that get worn out, or if that one part gets loosened up, so we always go and change it, and that can give an additional years or another 15 to 20 years of age. And even we can keep on going and revision and revision. And these options are right now available. So no need to worry about those options. What we want is an immediate quality of life.
That's very elaborated, Doctor. I think this 30 minutes is not enough, Doctor. I think we need to catch up again on the second part, I think. Thank you so much, Dr. Bharat, for your valuable time. Thank you, viewers, for your patience and for staying with us for the last 30 minutes. Somewhere we are all responsible, busy life, and we tend to forget to take care of ourselves. And most of us ignore joint pains unless we have no other way but to consult orthopedic surgeons at the last minute. Have healthy food, and that too on time. Exercise every day. And before we wind up, Dr. Bharat, what is your take-home message?
The take-home message is, as I said, knee arthritis is a common problem among our public. One have to have awareness about the knee arthritis. As I said, prevention is always better than cure. One have to stay healthy, keep yourself fit, do exercise regularly, keep your lean body weight low, or do regular exercises. And when it comes to arthritis, to your parents or to your elderlies, you don't have to hesitate about taking a call of a knee replacement, because knee replacement is a 200% successful procedure when it is done rightly on a right patient by a right surgeon in a right place. I think we as hospital have that kind of an infrastructures to execute these kind of procedures safely so that the patient have a successful results.
That's fantastic, Dr. Bharat. Viewers, coming Thursday, that is 21st October 2021, we have a Facebook live session with the legendary surgical oncologist, Dr. Jagadish Chandra Bose, who will educate us on primary prevention on breast cancer. And my colleague, Soumya, will be moderating the live session. Till then, stay tuned. All the best, Soumya. Thank you so much, Dr. Bharat. Thank you, viewers.
Thank you all. Thank you, viewers.
Thank you.
Thank you, Arun, and thank you for the team.